So let's jump in straight into our next talk. So it's going to be given by Ainsley-Marie Janowski. Apologies if I've completely said that wrong. From the University of Virginia. He's going to be talking about the clinical physics bootcamp for radiation oncology residents, a pilot study.
All right, well, thank you for the introduction. It looks like I can control things now. Thank you. My name is Einsley-Marie Janowski. I really appreciate being given the opportunity to discuss our clinical physics bootcamp for radiation oncology residents curriculum that we developed here at the University of Virginia. The physics curriculum is a source of anxiety both for medical students considering radiation oncology as a possible career and for current residents facing the physics boards. ASTRO currently recommends a comprehensive introduction to physics as a part of a physics core curriculum, though the recommendation on how best to implement this is unclear. To improve the orientation process for residents and medical students, we created a physics bootcamp utilizing clinically relevant patient vignettes to teach about physics fundamentals, electron treatments, photon treatments, brachytherapy, and urgent clinical setups. This was a week-long program of 1.5 to 2 hours daily. There were a total of 10 participants, including 8 residents and 2 students. Each day included a didactic session and a hands-on lab. The course was developed by a collaboration of clinical radiation oncologists and clinical physicists, though we also included dosimetrists and radiation therapists in teaching the bootcamp labs to introduce the various roles of radiation oncology treatment teams. There were pre and post surveys to rate student knowledge and comfort level with the radiation oncology workflow from simulation to patient treatments. And there were also daily knowledge-based assessments prior to and after each daily session to measure the information gained. Participant scores were paired for analysis using paired t-tests. Our educational goals were to introduce clinically relevant physics for patient care, to guide early learners in the connection between the technical aspects of treatment implementation and the clinical recommendations, to provide insight into each team member's roles, and to reduce anxiety and stress around the new topics of physics for early learners. Here's an overview of our bootcamp curriculum broken down by day. Day 1, we talked about physics fundamentals, which included a hands-on lab where there was a tour of the machines and an overview of how a linear accelerator works. Day 2, we focused on electron treatments with a hands-on lab, including a clinical vignette, a phantom setup, and plan simulation in the treatment planning software. Day 3 was photon treatments, where there was, again, another patient vignette where we selected an isocenter, put on beams, and changed the beam arrangements, beam energies, and beam weights to develop an ideal dosimetric plan for the goal of treating this patient. Day 4 was brachytherapy basics, which was a hands-on lab with an applicator show and tell, a film exposure demo, and an emergency protocol. And Day 5 was emergent clinical setup, where we did a hands-on demonstration of an emergent clinical setup with a Markin start calculation with the residents developing their own monitored unit calculation. The subjective questions we asked for each radiation oncology student included how well they understood the responsibilities of all the different team members on the team, how comfortable they felt with assisting with simulation, contouring patients, the required approvals before a patient is treated, how to handle an emergency on-call situation, how to assist with a weekend treatment start, and how to perform a hand calculation of radiation dose. Here are the list of topics that we covered during each of the didactic sessions. For physics fundamentals on day 1, we covered the basics of radiation, radioactivity and radioactive decay, how photons and electrons interact with matter. For day 2 on electron treatments, we talked about electron beam characteristics, the simulation process and tools that we use in simulation, electron dose calculations. Day 3 was the basics of how photons interact with matter, introduction to factors involved in calculating dose, and how to calculate monitored units. For brachytherapy basics, we did a brachytherapy workflow and how the HCR remote afterloader delivers radiation dose, what an AU, AMP, and written directive are, and the radiation safety procedures for brachytherapy. And for our emergent clinical treatments, we covered the most common clinical situations that require emergent treatment, how to calculate monitoring units for a simple field, and how to perform a second independent MU calculation. Here's our physics bootcamp in action, including scenes from our hands-on labs on the various days. When we assessed the boot camp and how it influenced our residents, the subjective responses are as follows. All participants reported an improvement in their comfort level with a different curriculum that we introduced. However, when we broke it down by early students and advanced students, and the early students are those residents who had a year or less of physics training compared to the advanced students who had more than a year, what we found was the early students had the biggest improvement and the advanced students was no longer statistically significant. However, when we looked at our objective responses or our fact-based information, what we found was that there was an improvement in all of the residents. And this was true both for early students and advanced students. All of them had an improvement in their knowledge base. We also separated it out by day, and what we found for all the different days, pretty much every day the early students had an improvement in their knowledge base for the different curricula that we introduced. For the advanced students, only the brachytherapy component remained clinically or statistically significant. So in conclusion, a formal physics boot camp orientation improves both resident comfort levels and knowledge base in clinical physics, with participants early in their training deriving the greatest benefit. By building on clinical scenarios often encountered in radiation oncology clinic, we emphasize the clinical relevance of physics and the safety and precision of patient radiation treatments. We hope that we will alleviate learner anxiety and provide early learner connections for the physics fundamentals of radiation oncology treatments. The feedback that we got from our residents, while the content was geared towards early learners, we were encouraged to continue including advanced learners in our training for several benefits: to reinforce simple physics knowledge connections that may be taken for granted, to reinforce advanced radiation oncology residents as mentors to early trainees, thereby allowing them to claim the teacher role. Our residents commented that the clinical emergent setup should be performed with each individual resident separately to ensure that each resident is clear on all steps. We will plan on doing this in the future. Our therapists appreciated our curriculum and continued performing urgent setup labs with other therapists to increase comfort levels in this process. In the future, we would like to expand our boot camp regionally, and we're working on adapting our curriculum so that it's feasible. And in conclusion, I just want to acknowledge all the people that put work into making this clinical physics boot camp possible. One of our radiation oncologists, Dr. Romano, and two of our clinical physicists, Dr. Scarborough and Dr. Schlesinger, as well as our dosimetrist, Sue Gare, and one of our therapists, Emily Wood. Thank you so much.
Fantastic. Really interesting presentation. It's got a couple of questions here in the chat already, so I'll read a few of them out. The first from Elizabeth Jeans. The question was time protected? I assume that means the learner's time was protected. And do you plan for assessment at a later date to reflect on retention of information?
Yes to both of those. Time was protected for our residents, and we do plan on continuing this and doing future assessments to make sure that the content is retained by the residents.
I'll have a follow-up on that. Was it difficult to obtain that protected time? That's always an issue I've found in certain institutions.
That it's always a challenge, but our colleagues are very supportive of our educational curriculum, and we really didn't have any time reserving our residents for the clinic. I think the bigger challenge was reserving the machines so that we didn't delay patient treatments, but it was workable, and we were able to do it either at lunch or in the morning time before the clinic got real busy.
Another question from Simon saying, do you think lesser improvements for senior residents could be due to ceiling of confidence on a 5-point scale? A few other follow-up questions, but I'll start with that.
Well, I thought that was an interesting component. So the subjective responses really didn't show that big of an impact on our senior residents. They felt pretty comfortable in all the different things that we featured, except for the emergent parts of the treatment. Some of them didn't feel quite as comfortable with that aspect. But I thought it was pretty telling that even on the knowledge base that our residents had a little extra things that they could learn from this process. So we thought it was great. And also the fact that our junior residents contacted our senior residents with questions, I think solidified the senior residents' knowledge about the different skills that they were testing.
Perfect. All right. So there's a few more questions in chat, but I might get you to reply to those individually, just so that we can continue to stay on track. But a really great presentation. Thank you for
Thank you.
for it.
Great presentation. I can see someone in that group read the curriculum development book, so good job.